METEOR, METEOR version 3, is predominantly a basic and translational research experience. So the kids have been placed in a large number of different research labs in the Center for Neuroscience Research, Center for Genetic Medicine Research, and the Center for Cancer and Immunology Research.
On the Conway Nursing Pathfinder Program, which is a philanthropic funding for Conway Nursing Pathfinder students from high school to particularly have an interest in nursing. And they receive a scholarship, they receive mentorship, and they receive an internship.
We have well over 150 students over the summer that are research trainees within the research enterprise, working with our laboratory-based research teams as well as clinical research. But we also, over the last couple of years, really expanded it to other professionals in the biomedical research enterprise. We have interns in communications. We have them with our financial teams and grants administration. We have them with the engineers and across multiple careers.
My experience with Children's National was really good. I gained connections with a lot of other physicians, and it helped me get another internship that I'm currently working at. I'm currently a Children's National Research Intern in the ED department.
I actually started doing more things based on health related in advocacy. I did a lot of learning about policy based on global health. I started the chapter of HOSA, which is the Future Health Professionals Organization, which is an international organization in my school to learn more about healthcare and all the aspects that were related to healthcare.
I was in a dual enrollment class at Trinity that I took for 2 years, and it was nursing, general nursing. And I feel like that sparked my interest, but also me being here, I feel like it also just set in stone, this is what I want to do because I see it head on.
My confidence definitely has boosted. I feel like I'm a little bit older. Being in here, I feel like I'm more of an adult because I'm given more freedom with learning.
I think teamworking, communication was also one of them. I was a very shy person entering, I think, the internship. I remember I would be like, should I talk to this one person? Should I tell my supervisor I'm having trouble? And I think I came out with all this new confidence as a new person I was.
With the METEOR program, it helped me get my first chance of doing research, analyzing data, knowing what's important to pick out, things of that nature, like decision making.
I know for sure I could do an EKG for sure. I also know I could do a manual blood pressure too. I feel like I've just been gaining confidence as I'm learning throughout the days I come to work.
I feel like more people just volunteering and giving their times to also be educators for once for the youth would be something that would be really appreciated. Either shadowing experiences or just mentoring advice would be really helpful.
Getting the word out there, mainly making sure that the schools are advertising that there is an internship that they can do, especially if they see that the students are interested in anything healthcare related. And then listening to the interest of the students themselves, seeing what they like, seeing what they are interested in, seeing if they don't know what they are interested in, and let them be able to explore everywhere to get their hands-on experience to see, oh, I like this, let me go towards that. I think that'll be really helpful.
I feel like you guys should give a better opportunity for the students to have hands-on work or do shadow and watch the nurses.
I think providing more opportunities in STEM, just going around to the schools, introducing STEM or what is included, because I feel like it's a lot of kids that want to be doctors or just maybe just don't know or have the knowledge of how to get there or what opportunities are out there, because there's a lot of opportunities. You just have to be informed about it because they're not going to fall into your lap. You have to actually, get out there and experience and network
introduce people and students very early on in the career is absolutely critical. You need to make it an institutional priority.
It's vitally, vitally important that you have systems in place to be able to evaluate your programming, to know what elements of the programming are successful versus not successful.
It would be meaningful if Children's National could create a strengthened and mentorship program that supports the developmental stages of youth, building in connections, and not only with nursing or physicians but with other services such as environmental services. And so having that, building a mentoring connection between employees and youth in our community, expanding it would really create a new face for Children's Hospital.